All right, let's take you here now. As the country enters the flu season, a concerning trend has emerged. The Eastern Cape Health Department is urging parents to take precautionary measures for their children following the emerging of the contagious flu virus ahead of the winter season. Now, let's discuss this further. Dr Angelique Coetzee joins us now. Dr. Coetzee, thank you so much for your time. So when you consider, that the influenza virus causes around 11,000 deaths per year in South Africa, with around 40,000 people also being hospitalized. Just talk to us about how concerned then should we be about this particular influenza?
Good afternoon. Thank you for allowing me to be here and to share some of this information with you all. So I think it's, first of all, very important to understand that every year we will have a flu or influenza season. It normally started between mid-April and early June, peaks late in June or early in July, and ends around about August and September. We also need to understand that for now, what we are seeing in South Africa, it's the beginning of our winter season. We don't know how severe it will be in the end. It's very, very difficult to predict. But the two most important influenza viruses going around is influenza A and B, and they are seasonal. But please understand, you can also get right through the year influenza. Influenza C is much more seasonal and not as severe as your A and B. So we will more, if we talk about influenza, we normally talk about A and B. So if you look at A and B, it is important to understand that influenza A has got the H3N2 virus and the H1N1, and that's influenza A, that's the subtype, and then we have B and B lineages. So we talk about subtype when we talk about influenza A, and we talk about lineage if we talk about influenza B, not hepatitis, sorry. And they are accounting currently for about 50% of the circulating viruses. Also understand, please, that we expect that we are going to see a triple endemic, which is a combination of flu, COVID-19 and RSV, which we haven't actually seen during the COVID period. We more saw COVID and flu and what we call a twin-demic type. So yes, it is true that we are going in. It is of concern, especially for young children under the age of 5 and the older people, especially above the age of 65, pregnant women, women who delivered babies, people in nursing homes, long care facilities, doctors, anyone working with healthcare or healthcare personnel working with other people. And then, what we always say, people with chronic asthma, heart conditions, diabetes, all of that, they need to get vaccinated. It will help because we know, as you already said, that anything between 6,000 to 11,000 people on a yearly basis die from influenza and influenza-related diseases, because you can get severely ill. You can get pneumonia from influenza. It's a very important statement.
And I mean, I'm sure you've heard that people are also concerned that this could signal COVID-19 because the symptoms are so similar. So, I mean, how important is it then to, allay those fears that this, in fact, is not COVID-19?
That's a difficult one because, unfortunately, influenza A, B, your RSV, your COVID, your Bordetella pertussis, as well as your colds, your rhinoviruses, all more or less present with the same clinical symptoms. And one of the ways that we can distinguish is by doing a PCR swab, and that can help us with a COVID or whether it's RSV or influenza. Unfortunately, those tests are quite expensive. And I'm not sure whether that would be available for each and every one. It's not cheap. We're trying at least to do a COVID test, and that's about 300 Rand. Influenza tests around about 80 to 100 Rand. But if you do the combination of all of them, it's nearly 2,000 Rand, and it's quite expensive. If you look at the treatment is more or less the same because it's viral infections. And again, it's difficult. It's very, very difficult to distinguish between these different type of viruses going around.
And Doc, just looking at, the rate in which people are infected and hospitalized, I mean, would it not, just given the lessons that we've learned from COVID-19 restrictions, adopt some of these restrictions? And how would that look like in this case?
Oh, yes. I think that's good policy. So first of all, just understand that your incubation period is normally 1 to 4 days after you have been exposed. And so it means that's how long it takes before the virus actually starts to attack you or you starting to have symptoms. Unfortunately, 1 day before you start to have your symptoms, you will be highly contagious up to around about 7 days afterwards. So what do? You do not go to work. You rather stay at home. And that's, so the first thing is the measurements that we have done during COVID. It is try to wear a mask if it's possible. Look at your circulation, your air circulation. Wash your hands. Use a tissue. If you can, go and get vaccinated against flu. It will protect you around about 50% against the other viruses or strains that's going around, but it will protect you against severe disease. We know that. So that if you then get your flu and you have been vaccinated, your duration will be shorter, as well as the fact that the chances that you will end up with the complications like pneumonia and all of that, especially if you're above the age of 65, in a hospital setup are greatly reduced. Then there is no antibiotics for colds and flu, RSV, COVID. I need to stress this because patients got this idea that they're going to see the doctor, going to get a few antibiotics and they're going to get better. It's not going to happen. You have to stay in bed, take normal precautionary measurements, anti-inflammatories if you're allowed to use that. And please, if we can see you within 72 hours after you started with your symptoms, we can prescribe oseltamivir to you, which will also greatly reduce your symptoms. So it is important for people with certain conditions to go and get themselves vaccinated.
Dr. Coetzee, thank you so much for that, of course, very valuable information there. That, of course, is Dr. Angelique Coetzee just talking to us there about what is currently circulating, which is, of course, the influenza.